If you have IBS, IBD, or any inflammatory condition, you should know what's in your gut. Shirley had food allergies to everything except about 5 foods: meat, eggs, cucumber, squash, green beans. Anything else and she would feel this painful tightness around her neck like she was being choked. Her hair would fall out in clumps and she wouldn't sleep for 3 to 4 days. She rated her urge, desire, or craving for carbs as 10 out of 10, but the pain was far worse than fighting the urge. Shirley went from doctor to doctor for 10 years. Every doctor said the same thing: you check out fine, just avoid those food allergies. She started having food allergies 10 years earlier. After certain foods, she would feel a tightness around her neck, like she was being choked, and what she called adrenaline rushes in her gut. Doctor says, you check out fine, just avoid those food allergens. But it got worse. Her hair started falling out in clumps. Foods that were fine started reacting. One time, a panic attack from almonds. Her sleep was affected. Now, if a food reacted, she wouldn't sleep for 3 to 4 days. She was exhausted, depressed, and still. Doctor says, you check out fine, just avoid those food allergies. She was super pissed when I saw her because she was clearly not fine and they kept telling her that she was fine. Listen to what her average day felt like, graded from 0 to 10. Back and neck pain, 7 out of 10 daily. Depression, 10. Anxiety, 9. Energy, 1. Quality of sleep, 2. Her period, 10 out of 10. Unbearable. She couldn't get out of bed. We asked, how much has your health affected your ability to work, be happy, and enjoy life? 10 out of 10. Shirley was miserable. She couldn't live like this much longer. It didn't feel okay, so she started doing her own research. She found that candida infections could cause, and candida is often caused by antibiotics. And she had a terrible sinus infection before all this started, taking several rounds of antibiotics to try to clear it out. Could that? She asked her doctor. She described his response as demeaning, to suggest that I may have caused. Candida isn't scientific medicine anyway. When we did her stool analysis, which tests for everything, she did have candida overgrowth and a threadworm infection. She was not okay, and it inflamed her gut, causing food reactions, not allergies. It's the sunburn effect. If you burn your skin, a wool shirt might be uncomfortable, but it's not a wool allergy. It's inflammation. When we cleared them out, she could eat everything: wheat, gluten, even drink beer again, within limits, like everyone. I offer this stool test to non-members because it's more between you and the lab. I get a little fee for reporting and answering questions, but the report you get tells you exactly what to do, what got inside of you that shouldn't have, and what kills it dead. If you need a good source of herbs, I can custom blend whatever the lab suggests. If I would have seen Shirley with her choking feeling, gut rushes, and panic attacks, I would have done this. I would have grabbed these 2 points and looked her in the eyes. Shirley, look at me. Right here. I'm calming this reaction down and we'll figure out what caused it. Just breathe. Spleen 10. They say that you can watch the rash disappear as you hold it. Stomach 34. The HSI point. That's what they call the point for acute attacks. Press the HSI, pronounced she point. They use histamine blockers for acid reflux. So this point gives you acute histamine blocking, allergy support. I'd calm her and relax her. And people would say when she walked out, "Oh my God, Shirley, you look stoned." And that's how the shirt came to be.